My name's Peter Baker. I'm the Chief Executive at the Men's Health Forum, and I'd like to extend to all of you from the Men's Health Forum a very warm welcome to the Emirates Stadium for the launch of Men's Health Week 2012 and our new YOLO campaign. Well, first I'd like to thank you all for coming on a rather grey afternoon. At least it's not raining. It was pouring in Brighton when I left this morning, but it's nice to see it's not raining anymore. But thank you for coming. I'd also like to thank Arsenal in the community for donating this fantastic venue, and we couldn't really ask for a more appropriate setting for the launch of a Men's Health campaign. I'd also like to express my gratitude to all those organisations that are supporting Men's Health Week 2012. And you can see their logos on the TV screens around the room and find out more about them on our campaign website. And I'd also like to thank those organisations that are supporting us financially. Lilly is supporting this event, and the week as a whole is being supported by D.Vyzor and Bayer. Men's Health Week is much more than a 2-hour event in London. It's about communicating and engaging with the man on the street across England and Wales. And we expect over 1,000 local events to take place this week, right across the country. And these events range from health checks, workplace talks, and football matches for young dads, to comedy evenings, cookery courses, and making smoothies using pedal power. And if you want to find out about some of the activities that are taking place, again, please look at our campaign website. We will also be reaching men directly through the media. If you haven't already seen it, please do take a look at the campaign website, menshealthweek.org.uk. This is a new site for us, a new departure, and we're really pleased with it. We're also using social media very intensively for the first time this year, and we're delighted to be working with 2 major media partners, GQ magazine and Reader's Digest, both of which have covered the week in their latest issues. To help Men's Health Forum and other organisations attract men's attention, we've devised a new health campaign, YOLO, You Only Live Once, that's also being launched today. And you may well have noticed our cheeky posters on the pillars here and on our website, and I hope that some of you will have ordered them for use locally. Now, these posters may not be to everyone's taste, but we know that we have to do something different to engage men, and being eye-catching and using humour is one effective way of doing that. YOLO will run well beyond Men's Health Week and will become our main health campaign brand, so please keep an eye out for the next phase. As an important part of our media work, we've also teamed up with Benenden Healthcare Society to survey 2,000 dads about their health. And we found that 1 in 20 dads say they're so tired they've fallen asleep on the toilet at work. And 1 in 5 dads has texted someone in the same house to avoid getting up from their seat. But the serious point is that our survey found that the lifestyle of too many fathers is very unhealthy, affecting their contribution to family life and increasing their risk of serious health problems. We also asked 500 young adults about their dad's health and found high levels of concern. 60% of young people said their dad isn't fit or very healthy, and half think their dad is overweight. And that's why we're inviting children of all ages to send their dads one of our new Father's Day cards containing a health message. And these cards can be sent free of charge from our Men's Health Week website. This year, Men's Health Week is focusing on heart health. This is the 11th Men's Health Week we've run, and it's actually rather surprising that we haven't tackled heart health before, because heart disease is the most common cause of death and premature death in men. Over 950 men die each week from heart disease, and 400 of them are under 75. Men are much more at risk than women, especially in middle age, as are men in the lower income groups. And we need to do more to tackle this. We need to do more to tackle men's unhealthy lifestyles. We need to tackle many men's low awareness of symptoms. And we need to tackle the problem of late diagnosis in men. More men need to know that erectile dysfunction is a critically important early warning sign of heart disease and not just a sexual health problem. Men over 40 should take up their invitation to the new NHS health checks, and the NHS must improve the delivery and marketing of the health check service to men. We need to begin to implement on a much bigger scale what we now know works with men to improve their health, such as taking programs to workplaces and to sports stadia like this one. We hope that the forthcoming new cardiovascular disease outcome strategy will take account of men's specific needs, and we're really pleased to have been invited to join one of the work streams which will be supporting the strategy's development. In a minute I'm going to hand over to three speakers who are actually doing what needs to be done nationally and locally, and then we'll have some comedy from John Ryan, followed by questions and discussion before we break for refreshments, stadium tours and the exhibition. But at this point I just want to depart from our written programme for just 1 minute to introduce to you our Chair of Trustees, Professor Alan White, and Alan is also the first ever Professor of Men's Health and is based at the Centre for Men's Health at Leeds Met University. Alan.
Just wanted... Just on behalf of the trustees for the charity, to thank you all sincerely for coming and supporting all the sponsors of the event and for everybody who is getting behind what we see as one of the most important challenges in health of the 21st century. If we can't get men's health, if we can't get young men's health right, then we have got a serious difficulty. So it's just a 2-second interlude, but just for me to thank you and to pass the baton back to Peter. Thank you very much.
Thank you, Alan. Well, without further ado, I want to hand straight over to the new Heart Tsar. I'm delighted that he's been able to join us today, and I'd like to introduce Professor Huon Gray, the National Clinical Director for Heart Disease.
Thank you very much, Peter. Thank you, Alan. Thank you very much, everyone, for the invitation to be here today at Men's Health Forum Week and the launch of the You Only Live Once campaign. I'm a cardiologist. When I'm at my day job, I work in Southampton, but increasingly I've spent time working with the Department of Health over the last 5 years, and then in March of this year was appointed as the National Clinical Director for Cardiovascular Disease. So I spend a fair amount of time at the department and considering issues to do with cardiovascular disease, and obviously that, by implication, is very much with men's health as well. Now, since I've been a cardiologist, which is now about 30 years, there's been considerable improvement in many aspects. We look at the rate of death from cardiovascular disease. It's been coming down for 40 years due to a variety of improvements. As an example, for instance, when I qualified in 1977, of those who were admitted to hospital with a heart attack, 22% of people didn't survive to leave hospital. Well, that survival rate, the death rate, is now down to 5 to 6%. Well, that's in one person's professional career. That's a considerable improvement. And much of this is down to the use of drugs and things like statins. It's an awareness of the disease. It's a reduction in smoking. And so you may say, well, the job's done. Why are we all here? Why are we still interested in cardiovascular disease? And the answer to that question is because it is still, despite the improvement, as Peter has already said, the biggest killer in the country. It kills more people than cancer does, still, even now, despite the improvements. And despite the improvements, and the UK has done very well by comparison with many other countries over the last 30 years, we nevertheless don't bear very good comparison with a number of European neighbours. So there's no question that there's still more to be done. We also know that cardiovascular disease and death from cardiovascular disease is 2 to 4 times more common in men than women, particularly in those who are at the younger age, young to 40s, 50s, 60s age category. And we also know that there's considerable inequalities around the country where survival rates are different depending on where you live. and that can't simply be explained by difference in ethnic factors and other things. It's delivery of services that is also variable around the country, and there's more to be done there. Social deprivation is a big driver of cardiovascular disease, and we know there are marked differences in social deprivation. One of the aid memoirs that I use is that if you start from Westminster, and you may well have heard this before, if you start at Westminster Tube Station and go east towards the east end of London, you lose an average of 1 year of life for each tube stop you reach. And that simply states that if you live in the east of the capital, your chances of surviving to the age of 80 is considerably less than if you live in central London. And that's in a major capital city, so that surely can't be acceptable, and we can certainly do some things about it. Because the important message to get across is that cardiovascular disease is, if not wholly preventable, is certainly preventable to a great degree. Prevention can be through identifying and managing people who are identified as having risk factors for cardiovascular disease before they actually get the disease. And here it's a great opportunity to stress what Peter has already stressed, the importance of the NHS health checks, which are being rolled out across the country. Now, men are particularly poor compared to women at taking up the opportunity of having things like health checks, and we've got to get the message across better to men and perhaps offer them health checks in different situations. But there's a stand behind here with the promoting the NHS health checks with all the literature that is available, and if you want to go and talk to them, I'm sure they'd be very pleased to let you know how things are progressing. Things are certainly improving. The overall uptake of NHS health checks is running now at about just over 50%. Well, that's 50% that aren't taking up the health checks, but nevertheless it's much better than it was a couple of years ago. What else can we do? Well, we can intervene on those individuals who are known to have cardiovascular disease because they've already had a stroke or a heart attack, because we know that there are a number of things that can reduce risk: treatment of blood pressure, treatment of diabetes, managing those who may not realize they have risk. We've heard about erectile dysfunction, that and peripheral arterial disease, maybe barely producing, well, erectile dysfunction is producing a symptom but not recognized by many as being due to cardiovascular disease, and peripheral arterial disease may be producing very few symptoms or just a little bit of discomfort in the legs when you walk. And all these are markers of high risk for future cardiovascular events. So we need to encourage men to participate in the opportunity to reduce risk, because it's not a futile exercise. We can very substantially reduce the likelihood of death over the next 10, 20 years if we get this right. So what are we doing about it? Just to wrap up, well, the Secretary of State for Health, Andrew Lansley, announced last December, recognising that cardiovascular disease was still a major killer and a major problem, announced the development of this cardiovascular outcomes strategy. This is a strategy that's being worked on at the moment under the leadership of Professor Sir Bruce Keogh, who's Medical Director of the National Health Service. But importantly, what we're working on is looking at all the ways in which we can reduce avoidable deaths, reduce the ill health associated with cardiovascular disease, wherever that intervention can occur. Obviously within the National Health Service, because this is clearly an area where you can intervene, but also importantly in social care and by public health initiatives to try and reduce the incidence of cardiovascular disease right from the outset. Now, this publication will come out in the early part of next year, probably within the first couple of months of next year, and I hope that it will actually encourage further developments and drive down what is a worrying increase in diabetes, obesity, lack of physical exercise and so forth, all the things that are actually everyone knows about. So it's a great pleasure to be here at the launch of the You Only Live Once campaign, which is going to run over a number of years, as I understand it, and to thank you and the organisers for inviting me to be here at the launch. Thank you very much, Peter.
Thank you very much indeed, Huon. And I'm sure some of you will have questions to Huon and the other speakers. If you could hold on to them, we'll have a chance to have some questions and discussion towards the end at about 4:45. It now gives me great pleasure to introduce Alan Sefton, who is head of Arsenal in the community. And before you speak, Alan, once again I'd like to thank you on behalf of the Men's Health Forum for donating this fantastic venue to us for the launch of Men's Health Week this afternoon. But over to you.
Ladies and gentlemen, it's my pleasure on behalf of Arsenal Football Club to welcome you to Emirates Stadium, especially if my doctor's in the audience, because I'll be seeing you straight after this speech. We are immensely proud of what I still refer to as our new stadium, as Peter said earlier, the perfect venue at which to kick off a week that will focus on men's health. Football is all over us at the moment, attracting huge attention. Vast TV audiences are captivated by matches. Millions have also been shocked by the revelation of horrific incidents of racism in the East European game. However, amongst this vast media coverage, there are many good things about our national game that are not covered and about which the general public have little knowledge unless they are directly involved. Allow me to introduce you to football in the community. Arsenal was one of the first clubs to start a community department in 1986. We started by encouraging people of all ages and abilities, male and female, able-bodied and disabled, to play football for fun. Recently, we increased our range of sports so that youngsters could gain inspiration from the Olympics by putting on sessions and starting clubs in 5 Olympic sports in addition to football: badminton, hockey, judo, table tennis and volleyball. Talking about the Olympics, we are proud that 2 of our community staff, Freddie Hudson and Jamie Monteith, have been honoured as torchbearers. Over the years, we have broadened our horizons to focus on how football can be used to enhance other aspects of life, such as education, training and employment, inclusion, and equality and diversity. Let me give you an example of one project that shows how this works. The project is called World on Our Doorstep, and we use the diversity of Arsenal's playing squad, which is made up of over 20 different nationalities, to illustrate and teach the importance of respect and knowledge of other people's cultures. Playing together as members of the same team demands exactly the same approach as studying together in the same school, working in the same office, and living together in the same community. Partnerships and working with specialists in their field is also another feature of our work. Local authority departments for housing, youth, the elderly, education are all important partners, as are the police and those involved with youth justice. Health is the latest of these. The Arsenal factor, as well as our long experience and unique approach to community engagement, was instrumental in Arsenal in the community being chosen to deliver the NHS Exercise on Referral programme. Steve Jamieson, from our partner One Deep Breath, will talk more about exercise on referral shortly. How Are You Feeling Today is another health-related football project. Twice a week, individuals with mental health problems are given the opportunity to experience the camaraderie of playing in a team, winning and losing, scoring goals and hugging each other. The recent Bristol study cast doubts on the benefits of exercise for those suffering from problems of mental health. We have evidence to the contrary, and an unswerving belief and commitment to use football and other sports to improve the quality of life for those with mental health problems. The elderly are also a group for whom we provide sporting activity. Our relationship with Treehouse as a past Charity of the Year has given us an insight into what football can do for children with autism. And we also have regular football sessions for deaf children and those with visual impairment. We have also been involved with campaigns to make men aware of signs of ill health and persuade them to go to their GP and seek medical advice. Our links with young people put us in a good position to advise them on matters relating to alcohol, drugs and sexual health. If we have a special relationship with groups who are difficult to reach, who might listen to us rather than others, we will consider the possibilities. Health is a key Premier League community priority, and other clubs who are bitter rivals on the pitch will work together on these programmes. Such is their importance. I won't name names. I will give you a clue in a second. But our near neighbours, we work together with them, believe it or not, to raise awareness of the signs and symptoms of bowel cancer and lung cancer. To sum up, we believe that football and sport is vital to the health of the nation, and the power, popularity and expertise of football clubs have an important role to play. In partnership, we are enthusiastic to play our part, and on this note, I'm pleased to hand over to Steve Jamieson from One Deep Breath, who will say something, I've got no idea what, about exercise on referral.
Thank you, Alan. Thank you, Peter. Thank you for inviting me today to the Centre of Excellence for Men's Health, Policy and Practice. I did read on the website Men's Health Forum collaborate with the widest possible range of interested organisations and individuals to tackle the issues and inequalities affecting health and well-being of men and boys. Partnership working is essential in our belief to bring service to the people in a real and meaningful way. Collaboration with commissioners like NHS Islington, service providers such as Lambeth or Greenwich or city councils, healthcare professionals, GPs, physios, mental health practitioners, commercial organisations, be it Oral-B from Procter & Gamble or Puma from sports and apparel, or of course charities like Cancer Research or Diabetes UK or Arsenal Community. They're all absolutely essential to put these sorts of messages into the relevant context for the relevant audience, for the people that need it most. As One Deep Breath, of which I'm a director, we were established in 2005, and our goal or our mission is to reduce health inequalities by changing behaviour for good. We have got a wealth of experience in different areas: smoking, poverty, the usual suspects, smoking, cardiovascular risk, physical activity. We've done some work in occupational health, oral hygiene, even promoting safe sex to teenagers with some credibility, which is no mean feat. However, all of these programs, we try and stick to a very disciplined process, which is called a National Social Marketing Centre process, which is starting with scoping in the community, speaking to the people, asking what they think about, the different organisations and their opportunities to become more healthy. And then we'll go on to develop, implement, conduct interventions, and then evaluate that in terms of the rate of return, but also in terms of the cost of the preventative action and the cost saving of if no action is taken and the implication that has to the NHS. Traditionally, these sorts of schemes, exercise on referral, which I'll go into a little bit more detail, but I won't take long, have been run in a gym. Okay, the doctor would say, okay, you have some issues, be it obesity, mental health, or physical disability, or physical like musculoskeletal problems, or cardiovascular risk, diabetes, and say, okay, go to the gym for the next 8 to 12 weeks and do some exercise. Funnily enough, those patients that then go to the gym, have their assessment at the gym, and then I think 49% of them were turning up, and I think 21% of them were actually going on to complete 8 weeks of exercise. So what we're doing is looking to innovate with Arsenal Community, take that sort of exercise out of a more traditional leisure-based setting and actually bring a programme of multi-sports for residents with sedentary lifestyles or low-risk medical conditions to the people. We offer a variety of exercise sessions, football, stretch and flex, lumbar, lower back stuff, plus, sports, swimming, gym sessions, outdoor sessions, gentle exercise, aerobics, healthy walks, anything that can get these people active. And when we first have discussions with Alan, he's like, look, this isn't going to be boot camp. We're not going to have people, shouting at people in the park. But what we do want to do is dedicate our time to socially include people and make them feel like they actually have the confidence to be able to continue with this scheme and give them the skills to then exercise independently after the programme. In terms of the commissioners at the NHS, we have got some pretty stringent key performance indicators. We've got to run the programme for 8 to 12 weeks. We need to get 70% attendance, 60% completion. So we were knocking on Arsenal's door saying, OK, first of all, we need to appeal to males. We've got a much higher proportion of females coming through the scheme than males. Can you lend us a little bit of your Arsenal football halo effect of male appeal? Having said that, Arsenal do have a very successful women's football team. So it's certainly not excluding women, but we wanted to get more males there. And we've also offered them a free stadium tour and an Arsenal T-shirt if they complete the scheme, which is proving quite a draw. In terms of results and evidence, it's early days. We've only been running the scheme since March 2012, but Stadium Tays are showing higher attendance levels, 61% compared to 49%. More males are joining the scheme at the moment, 45% compared to 36%. And our mid-term assessment surveys are recording high levels of either satisfied or very satisfied with the scheme, which is 90%. And what's really important for this scheme, which is really fundamental at the start, is to actually get people feeling they can exercise in groups. And all the groups are run with an Arsenal coach supervising them, and people get together, people are knocking on each other's doors, saying, are you coming along today? And that sort of group ethic is really kind of where Arsenal come in terms of team working, and that's where we actually get people starting to enjoy exercise and bringing exercise into their everyday lifestyles. Did you know that on average we're 3 stone heavier than we were in the 60s? We have, thank you very much, 2 minutes. We have much higher rates of heart disease. It was raging in the 70s, and we're also fighting a kind of sugar epidemic in the midst of this kind of obesity crisis. Eventually, the point will be reached when the cost to the NHS to manage these conditions become untenable. So these kinds of preventative interventions have to work. And together, we can get people to feel better with Arsenal Community. And that's all I have to say, and thank you very much.
Thank you very much indeed, Steve. And again, that's a very good example of how we can use football as a way of engaging with men. And we know there's very good evidence now across the Premier League clubs from other divisions, and also from the Premier League in Scotland, that these kind of programmes can work very effectively to improve men's lifestyle and their take-up of services. Anyway, you've now heard all the serious stuff. I'd now like to hand over to someone who must be the world's leading men's health comedian, John Ryan. So without further ado, over to you, John.
No pressure. Hello. Come on, we can do better than that. We're all sitting there all stuffily trying to think of stuff we can nick off those tables. We all do it. Should we have a little round of applause just on this side? Can we do that? Give a little round of applause on this side as well. Some louder applause on this side. Louder applause on this side. Let's have a big cheer, real proper big cheer. Come on. There you go. I noticed you didn't join in there, but you saw a business opportunity. I like it. My name's John Ryan. I'm from Essex. Saw my first ever game of football at Arsenal and have supported Man United ever since. I travel the world doing comedy. For some reason, seem to have grabbed a little niche talking to men about their health. So I guess we just crack on. But best way to show you is to do it. Can I ask every man in the room to stand up, please? Every man, stand up. Quick. Come on, chop. Can I ask the women in the room to please give the men a big round of applause? Come on, give them a proper clap, girls. Give them a little cheer as well. Come on. Now, see, the difference is, if I asked women to stand up, they'd be awkward and uncomfortable, but men love it. Because there are women looking at them, and they kind of like it. Girls, if you look at the men, you'll notice there are 3 types of man in this room. You've got your first kind of leave me alone with his hands behind his back or behind his side. Then you've got your others who are kind of hands by their side, like, yeah, what about it? I ain't scared of you, fat boy. But most of them are covering their balls. So if you have a little look at that. So, what I'd like all the men to do, please, is take your right hand, cover your eyes, as quick as you can. Come on, let's get on with it. Right hand, cover your eyes. Good. Right, girls, I would like you to point at the man you think most likely to give you multiple orgasms. There are a few blokes now looking through their fingers. Okay, if we can ask the guys to sit down, apart from you in the front row, if you can come and just form a line across the front here for me, please. Can I have a little round of applause for our little volunteers here? Form a line, it's okay. Do you want to move over that way a little bit? Move over that way a little bit. Okay, are we all familiar with the full Monty? Oh, now we're talking. This is how YOLO works. Basically, I go into the most difficult places. I do comedy clubs, but I've been into like men's prisons. I've been paid by the Home Office to go into a men's prison full of lifers to talk to them about their health so they can live longer in prison. It's not easy, that's what I'm saying. Do you know what I mean? Although while I was there, I did discover, did you know if you don't buy a TV licence, you can end up in prison? Did you know that? And do you know what they give you for free when you get to your cell? A television. It's amazing, isn't it? I also went into a women's prison, again full of lifers, to talk about women's health. And the thing that struck me most about it was that these women were on life sentences. Not one of them made a pass at me. So, these 5 guys represent all of humanity, all of the men of the country. Can we have a round of applause for our 5 men here, please, if you will? And you'll notice, again, reverting to type, we've got 1, leave me alone. We've got 2, minding their balls, and 1 with a football shirt on. Come on. These 5 guys represent men. When we look at statistics, what statistics mean nothing to normal people, to your average bloke. 50% of married couples are men. It means nothing, right? They're just statistics. 8 out of 6 people can't count properly. Right. So, on the way home, you'll be going, I get that now, that's quite funny. I get 5 men up because basically, according to statistics, 1 in 5 men will develop some form of heart disease by age 75. 1 in 5. It's ridiculous. Predictable, treatable, preventable. 1 in 5. I'm just going to ask you to sit down, man. I ain't making no aspersions, but this is what it looks like when they leave. See, we're left with 4 men. Can I have a little round of applause for my 4 men? We have 1 in 4 people suffer from depression or anxiety at any time. Again, treatable, detectable. It's no big thing. Same with the heart disease. No big thing. 1 in 4 people. Can I ask you to sit down, mate, just to leave them nice and pretty in the middle? A little round of applause for my helper. I think it's important that we all have one statistic that we take home from today. There's one thing that you remember, and that is the most important statistic I will tell you, ladies and gentlemen. 1 in 3 men has admitted to having had sex at work at some time. Can I just ask what your job is? You're a patient. Okay, that's a job. You're paid to be a patient. Yeah, okay, fair enough. That's one way of getting at it. Yourself? You're a patient. What sort of patient? What are you a patient of? St Andrews. Okay, well, at the moment, mate, you're up here with everybody else. This is how good it gets. Where do you live? From Birmingham. Do you have anyone else from Birmingham? No, you're on your own, mate. They're just leaving you. Can I just point out, though, from Birmingham, this is a Premiership football ground. About yourself, mate? You teach PE? Please don't let it be him. Can I ask you to sit down? A little round of applause for my mate there as well. Got 2 guys left, right? It's about statistics. 1 in 2 of us can develop cancer at some stage. People die of cancer, but most people live with cancer. In this room, there will be people who have been touched by cancer at some stage in their life. It's preventable, it's treatable, it's not the end of the world. I'm not casting aspersions on you, mate, if you'd like to take a seat. Can we have a little round of applause for him? Finally, this man represents every man in the country, ladies and gentlemen. Take a look at him. This man is typical man. Do you know why? Because like every other man in this room and in this country, nothing's going to happen to him. He doesn't need to go to the doctors, and he doesn't need to take his health seriously. And that's what we're up against. Can I ask? Can we have a little round of applause? So you have all these great eminent people with great ideas, and there's people at the front line trying to deliver a health message, and it's not easy. It's very, very difficult. It's hard being a man, isn't it, fellas? See that? See that? Like, yeah. It's easy being a woman. Am I right, girls? A lot of men now going, you are really on your own, fat boy. And it's nice hearing you talk about the gym. I go to the gym every day. Unfortunately, there's a Costa coffee on the ground floor. Carrot cake coffee, £1.50. Can't beat it. But it's difficult. Men will find any excuse not to go to the doctors, not to take their health seriously. And that's regardless of age, orientation, geography, whatever. Men, I think, are stupid. Does anyone disagree with that? Not even the men. We know we're stupid. And we look for excuses. We will look for excuses. Now we all know that having problems with an erection can be an indicator of heart disease. Every man in this room is going to try and work a way of getting some sexual activity later on tonight. There will be guys at home with the poster taking their partners out to the kitchen going, look, you can help me with this. And it's not like there will even be men who will try it with other women, and when they get caught will say, well, I just wanted to make sure it worked with her like it works with you, love. I'm doing it because I care. It is difficult. Men will always come up with an excuse not to take their health seriously. I met guys who have worked out that they're 5 a day fruit. What grapes constitute fruit, so they ferment it, drink a bottle of wine. That's part of their 5 a day. If you talk to some guys about grilled meat and salad, they'll say that's a kebab. Men will come up with excuses and reasons all the time. And it's not just about, obviously, heart disease. I'm sure that all the experts have all the answers. It's the stress of modern living, Stress is a really big problem that men have. Depression, I'm told, is the loneliest, darkest place in the world. You want to come to Hackney after 11 o'clock at night, mate. So all I can say, it's a difficult thing. If you have a mental health problem, people will shun you. If you have cancer, you get sympathy. We seem to need to do something about our priorities. When I go around talking to guys, all the health information goes over their head. They're not interested. They're not. Most men are overweight. You were saying most guys 3 stone overweight. We'll all find excuses for it. But I'm overweight, and I have to be to do this sort of work. If I wasn't overweight, nobody would listen to me. Also, we'll find excuses. If you work out with weights, you get big biceps. You should see how many sit-ups I've been doing, mate. It's all muscle. We will convince ourselves of anything to prove our point. I personally believe that women like a larger man as a lover. Girls, would you agree or disagree? A little bit too keen there, love. It's a fact. Larger men make better lovers. Just the noises. Now to take my other shoe off. So I go around and I talk about health, and I try to pepper it with little bits of humour, just to kind of try and get guys laughing, try and get guys talking. Because it's very, very difficult. Men don't know enough about our own bodies to be able to take our health seriously. Like, guys, how many of you know that if you're right-handed, your left testicle is larger? Be honest, how many of you knew that? No, none of you. Not even the experts. No. Are you right or left-handed? You're not telling me. I can tell by the way you're sitting, mate. Your right-handed, your left testicle's larger. Now, that's interesting, but also, it's now raised the curiosity of every woman in this room. And there'll be a few guys appreciating that tonight when they're in bed with the missus and she's looking no longer like a cat, looking at a yo-yo. Am I making you uncomfortable? Because health messages have to be told, don't they? Have to be told. And guys, we don't talk about our testicles. When was the last time you had a chat about your balls with someone? How's your balls? How are they, mate? Are they good? It's an awkwardness, isn't it? It makes people feel uncomfortable, and yet a simple health check could save your life. Women have got it differently. Women talk to each other. If one of the women here was in the toilet and, God forbid, found a blemish on her breast, another woman came in, she could say, excuse me, what do you think of that? And a woman you've never met in your life would say, there's nothing to worry about. Am I right? There's nothing to worry about. Go to the doctors. But if a man found a lump on his balls and the door opened and a man he'd never met in his life walked in, you couldn't really go, excuse me, mate. You wouldn't have a look at my balls for me, would you? So I figure if there's one thing we can do today, and there's one thing that I can demonstrate to you, it's a little simple health check. Can I ask you, my friend, if you'd like to come and help me? Well, yeah, guy with a T-shirt. Can we have a little round of applause for my helper? Right, man. He's a bit bigger standing up than he was sitting down. Is there a smaller person? No. Where are you from? North Cambridgeshire. Okay, it's all right. I'm not going to rob your house. Don't be too specific. Right. Do you take your health seriously? Yeah. Are you fit? You look kind of fit. And look at the women. Look at him. Look at me. Right. See how much time he spends on his body. I'll be spending that time on you girls. It's just an excuse. It's just an excuse. Do you know how to check your balls? Have you ever checked your testicles? Hold it for a second. I'm going to show you how to check your testicles, right? This is the easiest thing ever, right?
Are you gonna do it here?
No. Listen, mate, this is the Men's Health Forum. They've got all the latest IT technology. Arsenal have invested in today as well. They've given me all the stuff I wanted for this bit, so... If you'd like to take these 2 lemons, these are now your testicles. I'm going to quickly show you how to check your testicles. First and most important thing, guys, watch this very carefully. Could save your life. First most important thing about checking your testicles, mate, is never ever hold them there. Are you right-handed or left-handed? Both hands. They're the only lemons I got, mate. I wasn't expecting this. Do you want to hold them at the... Yeah? Do you want to... There you go. Right, first thing you notice... Mate, this is going to so work for you, right? This could be the makings of your new career. First thing you do, count them. 1, 2. Good. 2 is a good sign, right? 3, check your pocket for a key ring. 4, there is someone else in bed with you, basically. So you check them, you just give them a little roll forwards, little roll around, have a little feel of them, you know, there you go. Yeah, see, it's good, you have a little feel. It's good to do this like after a bath. You get out and you just make a little thing of it. If you feel any lumps or if there's any discomfort, basically you sort of visit out to the doctors. It's that simple. Does that seem simple enough to the guys? Now, obviously, it's not just for us to do. We need to share this. Can I ask you to help me, please? Can you just quickly come in? Can we have a little round of applause? A little round of applause for this young lady. Thank you very much. What's your name? Beverly. Beverly, sorry, what's your name? Z. Okay, Beverly, you're going to check Z's balls. It's dead easy, okay? What you need to do is give her if you can just stand here so everyone can see. If you could just give her your balls. Take his balls, Beverly. That's it. That's excellent, okay? Make eye contact. It's all helpful. And, just have a little chat about the day. Having a good day? How was your day? It was all right until the fat bloke got me up. Beverly, you check his balls, you count them. Never, ever, ever, right, do this after an argument. Now, if you let go of your balls, it's okay, she won't hurt them. It's okay, you can let go. Good man. Now, can anyone see what Z is doing wrong? His balls are in a woman's hands. Where should his hands be? If you could both just look at the camera. You count them, you have a little check. There you go, that's all there is. And then you make sure that the erectile dysfunction thing's sorted and his heart will be fine. Ladies and gentlemen, can I have a round of applause for Bev and Z? It's a simple kind of bit of fun, but at least it may get someone talking or someone taking their health a little bit more seriously. And some of the places I go into, we're not dealing with guys who read the literature that is being printed and who have access to the internet. They're just everyday, typical guys who are statistics for the rest of us. There is one statistic I think really does sum up the problem more than anything, and I'll leave you with this. I believe that 100 years ago, women were living 3 or 4 years longer than men, and now they're living 10 years longer than men. And at current rates, in about 300 years' time, there'll be no men left. Now, some of you girls might like that idea, but by then maybe there'll be a vibrator that can mow the lawn. But there'll always be spiders. Thanks ever so much for your time. My name's Sean Ryan. Cheers.
Thank you very much indeed, John. And that's a brilliant example of how you can use humour to reach men around health. And I have the name and number of his agent, if any of you want to book him. I'm sure he'll be delighted. So thank you very much indeed, John. Now I can, for the next 15 minutes, before we start the stadium tours and have refreshments, it's an opportunity for anybody to ask questions to any of the speakers, including John, and also to make any comments they might want to make about what we're trying to do here today. So over to you. We have a roving mic as well. So if you have a question, put your hand up and tell us your name and who you are. Thank you. Glenn.
Glenn Poole from the Men's Network in Brighton and Hove. I'm also the UK's coordinator for International Men's Day, and I host the National Conference for Men and Boys every November in Brighton. In our city, Peter, poor boys will die 13 years younger than rich girls. So there's a massive gap, right, in the health of men and women. It's not just about gender, it's about many, many different things. Now, I go around the country trying to collect the very best examples of projects that are working really well with men and boys, not just in health, but in every field. And what I found works is that the projects that ask the question, what can we do better to attract men, rather than why are men so crap at accessing services, are the projects that do the best. In the experience of the speakers, what is it that the actual projects that deliver services, what do they do that makes a difference?
Stephen, do you want to have a go at that? And maybe Alan would also like to comment. Done a lot of research in this area.
Sure. Well, the first thing we'd do is start asking, trying to address their barriers, trying to find out why they wouldn't want to take part in kind of an exercise or activity or something to improve their health. For example, people, when they wanted to join an exercise scheme, we did a lot of research in terms of behavioural change theory, in terms of people's attitudes, people's sort of social norms, what people's belief is that they can exercise. But then there were simple things like people were saying, well, do I need to get my knees out? Do I need to get undressed? Do I need to, people are conscious about their body shape or size. Unfortunately, our programme only takes 16 plus, so I don't know about the young boys, but you've just got to try and address every single barrier that they might have because, as John was saying, people will make any excuse, and we're inviting people to the stadium and we're trying to put on all the activity within a kind of 30-minute commute of their home because people are saying, I don't want to go to the stadium, I've got to go across the borough of Islington. I don't leave, my little kind of housing estate or enclave. And literally, if we can't put on the community venue next door to where they live, they'll be like, well, I can't get to the stadium. So that's kind of a very simple way of looking at, how you address, just the physical barriers, but then all the emotional barriers that you have to address, like getting people to exercise or getting people to look after their health. Yes, you can put on the facilities, and as a gym or a leisure facility has, and you can make it cheap. You can, do the programme at £12 for 8 weeks and say, that's £1.50 a session. Surely everyone's going to be knocking the door down. But still, it's like trying to get them to go to a dentist or something. They're not interested, just really not interested. So we have to phone them, we have to text them, we send them a letter, send them a map, send them an invitation, then give them a text on the day, probably give them another phone call, and it's kind of like, right, and now we've managed to get 61% sort of turning up to the first, assessment. And then trying to motivate them to continue going, then there's another job, that's just the start of the, the action. So yeah, it's just hard work and a lot of communication, a lot of behavioural support. It's, one side of the coin is actually trying to address the physical activity and the health issues. The other side is actually getting their brains in the right place where they think they can believe, that this is going to help them, and they have the confidence that they can actually, continue to exercise, and it's going to, have an impact on their future, life. They've got this cognitive dissonance, which is like, that's happening to some people, but it's not going to happen to me, just trying to bridge that gap.
If you can get guys engaged, then you can start to do something with them. If you go, we did work with the Bradford Health of Men team. Why did their work? Why was their work successful? Because they went to the men. The work we've done in the workplace. Why is that successful? Because it's on their doorstep. I've never yet met a man who doesn't care about his health. What I find is lots of people who have problems with their health, but they don't know quite what to do about it. And actually making it simple makes it okay. And actually, if you make it simple and okay for men, you're massively improving things for women as well.
I'm Jean Arrowsmith from Coventry City Council. I worked for the health service for 25 years in all acute areas, mainly with men. And I just find it so tragic that the medical model and the approach that is still paramount, everybody here knows what to do. John's just done, the most brilliant comedy act, but portraying it beautifully, and the same with the work you're doing. What is the medical model? What is the medical profundity? Because my experience is still that the public health director and the local GP say, oh, look, the men are still dying 10 years earlier, and pass on, because they expect that to say that. So they don't think it's unusual or different. And it's abysmal. It's just all appalling that our GPs and our consultants and our public health people are still working. If you still do the same thing and you measure the same thing, you're going to get the same results. And yet we know what the statistics are. We know what the evidence is from Alan. We all know what to do, but we're not doing it. And we're not offering incentives. We've got a lot of really good proactive GPs and consultants, but they do it individually because they care about it. But men just do not count as a whole in this country. And we're not providing incentives in the QOF, in all the other incentives that we provide, where we provide money. We don't do anything about it. And I'm hoping that you've got the post and you've got the role, that you are going to be proactive, because anybody here already knows what to do and how to go about it. But I want to see within 5 years that it's changed, and I don't actually have any expectations that it's going to change.
Well, that's something of a challenge. 5 years to get it right, and with no expectation of anything improving. I mean, a lot of the points you make are, of course, very reasonable points. As a profession, I don't think the medical profession has done particularly well at communicating. I would accept that on behalf of the medical profession. I'd slightly take issue that it's because essentially there's a lack of sort of caring about it. I think that much of it is because there are so many other things that seem to be more important, and one's been pushing to some extent against something that doesn't seem to be movable. I think we need to learn a great deal more about how to communicate since we're talking about men, it's men, but it could equally apply to women. For instance, with regards NHS health checks, it's very likely that it'll arrive as part of the junk mail that arrives in your house, so you may not even notice that you've got the letter. When you open the letter, it's a photocopied piece of paper that doesn't really communicate what it is. You phone up, if you get to the point of phoning up the surgery, you may find someone doesn't really know what the health check is. I mean, there are all sorts of barriers that are correctable, and that's down to the profession, the Department of Health, social care as well, dare I say it, for the future, to get things better, and to join up the care that we've got between the NHS, social care, public health, because in that way we'll start to do better at preventing, as well as what the NHS does pretty well, which is dealing with the crises when they occur. What we want to do is to stop the crises occurring in the first place. So I accept the criticism. Whether I can achieve what you want in 5 years, I don't know. I may not be here in 5 years.
Thank you. Got time for a couple more questions or comments from the floor? Yes, Paul.
Paul Keenan from Benenden Healthcare Society. Should we not be doing more in terms of the national curriculum and teaching young lads at school how to check themselves for different issues, talking about health concerns to them there, rather than leaving it until they've left school and perhaps they're in their early 20s and they've reached a stage where they just don't want to go along to their GP, perhaps?
We think at the Men's Health Forum that no boy should leave school, for example, without knowing how to make an appointment with his doctor. Very basic skill. Okay, thanks for that. Any other comments? Yep.
Kevin Herbert from the Health Protection Agency. Coming not from specific direct contact with people involved in public health as such, I don't know how much has been made of using a system like regular MOTs, kind of personal health check MOTs. Sorry? Okay, but is to people beyond kind of who you'd consider as the basic thing, because that was my idea of how we can actually get people thinking about it before actually having to present to a GP or the like with a particular problem.
Okay, thanks very much for that. Luke, sorry, if I can just take a couple more questions quickly. Luke?
Yeah, Luke Morell from Activity for Charity. Just a quick question for Professor Juan Gray. You just touched on earlier about some comparisons with other European countries. And I just wondered if we could if there's any comment about how, when it comes to communication, we compare with other countries on our borders. If we look at how they whether they have the same issues or not.
I mean, the short answer to your question is I don't know, specifically with regards to communication. I do know that actually if you look at the European comparisons, say 20 years ago and more recently in the last few years, actually the UK's performance at reducing cardiovascular deaths is actually near the top of the league. So something that we think we know what it is. It's a lot of it is down to stopping smoking, for instance, which has been a big change. But in terms of communicating better with those at risk, I don't know the answer to your question.
Yeah, I'd like to really, as a final opportunity, bring in Alan White to comment on that question, because Alan is the author of a major study of men's health across Europe, which was commissioned by the European Union. So I think he may have some insight into this, but also to pick up that point about the value of health checks as a way of engaging with men.
Yes, we completed the first State of Men's Health in Europe report for the European Commission last year. It covered 34 countries, had 36 academics working with me across Europe, and looked at a whole raft of different health conditions. And one of the things that stood out was the 630,000 men that die of working age, 15 to 64-year-old men, that 630,000 men compared to 300,000 women. And I'm actually in Copenhagen on Thursday, talking at a presidential event as part of the Danish presidency around premature death and how actually we are not addressing it. We're not picking up on the fact that these men are dying. And actually when you start to look at the differences between countries, you see massive differences between the Eastern European countries, Latvia, Lithuania, Estonia, and some of the Western countries. But that could mean we're complacent. But actually, if you take that picture and look at our individual countries, regions and localities within our own, as you were saying before, this massive difference in life expectancy, nearly all those differences in life expectancy we see within our own communities around cardiovascular health. And what we find is when the going gets tough, women get poorly and men die. And it's about how those men respond to difficulties. And with this current recession that we're finding ourselves in, and men losing their jobs, then the mental stress that creates the vehicle for alcohol abuse, it creates the vehicle for increased smoking, poorer and poorer diets, lower self-esteem. And so we actually have to be extremely proactive in reaching out to these guys now to be able to make a difference. Because if we go the road that we've seen in the Eastern European countries, then the whole panoply of problems are going to emerge completely to the detriment. One of the other things, very quickly, we found was that across Europe, we know there's going to be 32 million more men over the age of 65. What we haven't picked up so much is the fact that because of the lowering birth rate, there's going to be 24 million less men of working age, 15 to 64, across Europe. 24 million less men of working age. And some countries are hit really hard with that. We're not so bad because we have migration. But we have to be better at seeing men's health as an investment. We have to be better at seeing that the money we're putting into the prevention and the treatment, identification of the programs that we can see now will work has got to be to the benefit of society as a whole. It's not just a moral imperative, it's an economic imperative. And we just have to make that bit clearer for the politicians, I think, and certainly for the health strategists. Health MOTs, absolutely. I mean, but it's not just about telling a bloke to go for an MOT. And the research is showing that you actually have to give them an appointment, because 11.5 million men still are working full-time. Most of those men that we're concerned with do not have any access to flexi time. If you're not in that van at 8 o'clock in the morning and if you're not in it till 5 o'clock at night, you don't get paid. And if you've got a job that's so precious that you're not going to give it up just to go for a preventive health check. So what we're going to have is mechanisms for getting to those guys, because they're the ones who are most likely to die. The upper socioeconomic groups, they can find the time, they can do it, but it's the guys that we're most concerned with that have the most difficulty of getting access to health services. So it's not difficult, it's just a case of now finding the tools and the will and the resources to make it happen. So I just want to pass back to Peter again as the chair of the board of the trustees for the Men's Health Forum, a professor at my own Centre for Men's Health, and to yourselves, who are the people who are actually out there doing it. And so thank you very much indeed.
Right, well, thank you very much indeed. That concludes the talking part of today's event. Before you all go, can I just, first of all, thank all the speakers for their excellent presentations. We give them a round of applause, please. Thank you. I also wanted to thank the person at the Men's Health Forum who's done most to organise this event. I think she just walked off over there, actually. Renata Pucci. Renata, where are you? Thank you very much. And I'd like to thank you all for coming. You've heard what the problems are. By coming today, you've proved that you're part of the solution. So thank you very much indeed for coming and taking part. And please stay and talk, network, and have a drink with us. Thank you very much.